Have you or someone you love been told to get more tests just to be safe? What if I told you that one very common test, often done routinely, might actually increase your risk of a stroke, especially if you're over 60? As a brain doctor, I've seen it firsthand, it shocked me, and it may surprise you too. Today, I'll explain how one very common routine test ordered even when you feel perfectly healthy might actually trigger or raise your risk of a stroke, especially overnight. We're going to talk about what that test is, why it can be risky, and most importantly, what you can do about it. Stick with me because the goal isn't to scare you, it's to empower you. The test you need to know about. Overnight blood pressure monitoring. Let's start with the test I'm talking about. Ambulatory blood pressure monitoring, ABPM, also known as 24-hour blood pressure testing. This test is often recommended to check for hidden high blood pressure, especially in older adults. It involves wearing a cuff around your arm for 24 hours, which inflates every 15 to 30 minutes, including while you sleep. Sounds useful, right? It can be, but here's the issue. Research shows that frequent cuff inflation at night can trigger spikes in blood pressure and heart rate, especially in older adults who already have fragile blood vessels or stiffened arteries. Very common conditions after age 60. Why this matters. The brain and nighttime stressy or brain relies on stable blood flow to function and especially to recover overnight. When a cuff inflates during deep sleep, it briefly raises blood pressure and heart rate. For a healthy 25-year-old, this is no big deal, but for someone over 60, especially with mild cognitive decline, diabetes, or past mini strokes, that jolt can disrupt deep sleep, raise inflammation, and cause tiny bleeds or silent strokes over time. It's not just one night, it's the accumulation of disrupted sleep and repeated stress on aging blood vessels. Studies that back this up. A 2021 study published in the Journal of Hypertension, researchers found that seniors who underwent overnight ABPM experienced higher nocturnal blood pressure spikes compared to those who didn't. What's more, those spikes were directly linked to a higher incidence of silent cerebral infarctions, also known as mini strokes, that often go unnoticed until it's too late. Even worse, these participants reported poorer sleep quality, which itself is a known risk factor for stroke. Who's most at risk? If you're over 60 and have any of the following, you need to be especially cautious with this test. History of high blood pressure, atrial fibrillation, type 2 diabetes, history of stroke or TIA, mini stroke, cognitive decline or memory loss. Chronic insomnia or sleep apnea. These conditions make your brain more vulnerable to the stress caused by blood pressure fluctuations, especially while sleeping. What you can do instead. No, this doesn't mean blood pressure testing is bad. Not at all, but it means we need to be smarter and safer about when and how we do it. There are 3 safer strategies. 1. Opt for daytime monitoring only. Ask your doctor if you can wear the cuff during daytime hours, only avoiding overnight disruption. Many newer devices now offer more accurate daytime-only tracking with AI-based analysis without disturbing your sleep. 2. Try home-based manual monitoring. Use a home BP monitor to check your pressure twice daily, once in the morning, once in the evening. This gives your doctor consistent data without stressing your nervous system overnight. Make sure the cuff fits properly and always rest for 5 minutes before taking a reading. 3. Track sleep quality alongside blood pressure. Use a sleep tracking device or app to see how your body responds to blood pressure changes. If you notice poor sleep after testing nights, share this with your doctor. It's valuable data that helps tailor your care. *FAQs, your most common questions answered. Let's now address some of the most frequently asked questions I hear in my clinic, especially from patients and their adult children. Should I cancel my 24-hour blood pressure test? Not necessarily. The test can still be useful, but if you're older than 60 and have any vascular or sleep issues, it's worth talking with your doctor first. Ask, can we monitor during daytime only? Do I truly need overnight monitoring, or can we get accurate data without disrupting my sleep? If your doctor insists on full 24-hour monitoring, make sure they know about any stroke risk factors, poor sleep, or heart rhythm issues you may have. Are home monitors even accurate? Yes, when used correctly, home monitors are very reliable. In fact, some cardiologists now prefer consistent home readings over one-time office tests because they show how your blood pressure behaves throughout your real life. Pro tips: use an upper arm cuff, not wrist or finger monitor. Sit still with both feet flat, back supported. Wait at least 30 minutes after eating, drinking, or exercising. Log your readings to detect patterns. What about white coat syndrome? Shouldn't I monitor at home anyway? Absolutely. Many seniors experience white coat hypertension, where blood pressure spikes in medical settings due to anxiety. That's where home-based readings become essential. They provide a clearer picture of your resting day-to-day levels without the stress of a clinic visit. Why doctors don't always mention this? You might be wondering, why isn't this talked about more? Well, doctors are trained to be cautious sometimes. They want to avoid missing a hidden problem, but sometimes extra testing isn't safer, it's just more stressful, especially when it's not tailored to your unique health history. My job as a brain specialist is to weigh risk versus benefit, not just follow routine. That's what I hope this video encourages you to do: ask questions and be an active partner in your care. Tips for talking to your doctor. Want to bring this up without sounding confrontational. Try saying, I'm concerned about how this test might affect my sleep. Is daytime monitoring an option? Do I have any stroke or vascular risks that make overnight BP testing less safe for me? Can we use a home device to track trends instead? Doctors respect when patients are informed, calm, and clear. Print this video summary or bring notes with you to your appointment. If this video helped you feel more in control of your health, give it a like to support our channel. Share it with a friend or loved one who's over 60. Subscribe for more senior-focused tips backed by science and delivered with care, and tap the notification bell so you never miss a vital health update. We're here every week with real advice for real lives, because after 60, your health journey deserves clarity, compassion, and confidence. Thank you for watching, and as always, take care of your brain. It's the only one you've got.